Hello and welcome. Today we're going to talk about menopausal effects on the skin. My name is Tracy Montgomery and I talk about all things menopause, midlife and all that goes with it. Today I'm coming to you makeup free. Now I don't wear a lot of makeup, so you won't notice too much of a difference, but I do normally wear makeup, very light makeup, a light foundation covering, and I often use now a powdered foundation. I will come on to that as we go through this. So as we hit menopause, should say perimenopause, that's when those hormones start to do their jiggity jig and then they're on their way out. We can expect, now this is quite a shocker, we can expect for the skin to lose about 30% of its collagen in the first 5 years. So once your perimenopause symptoms start, the estrogen levels start to decline, 30% of the collagen is going to reduce. And then after that, there's going to be roughly about a 2% decrease every year for the next 20 or so years. So this is why the skin starts to lose its firmness and it starts to drop off. But it also, this decrease in estrogen, you said the wrong hormone then, has other implications and other effects. So estrogen is needed to keep the skin hydrated. So the estrogen produces all these ceramides, your hyaluronic acid that we hear so much about nowadays, and the sebum, that's the bit in the causes the spots. This is on your skin, and this is what helps to keep the skin hydrated. So as your estrogen levels decline, so do these ingredients, if you like, that keep your skin plump and firm. So you can experience more dry skin, you can experience itchy skin, which is quite a common symptom during the menopause. So what can you do? We've probably been told since we were little not to use soap on our faces, on our skin, because this can dry out the skin. So hopefully you're not using that. You can use like sensitive cleansers that are slightly foaming if you need to, but you need to be adding a moisturizer to your skin now to try and rebalance, support the moisture that you're losing from your skin nowadays. Lighter moisturizers are a lot easier to apply and to be absorbed during the daytime, and then a different, heavier, if you like, nighttime moisturizer. You can often get products that are marketed as daytime and nighttime moisturizers. Now, bear in mind that as your skin changes, some of the ingredients that you've used previously aren't going to be tolerated by your skin anymore. So you might need to consider using different products. So as the skin changes, we might also find that we are flushing more, we are getting redder more. Now, I've got quite red skin anyway, but you may notice that you're getting a condition called rosacea, and this is where the blood vessels closer to the skin surface and they flush your skin, so you become quite pink in complexion. So this can be aided by lifestyle choices. So decreasing your alcohol, your caffeine, we know we're meant to do that anyway, avoiding your spicy foods, sun protection. Now, sun protection is quite a big one because we think that we only need sun protection in the summer when the sun's out. Well, actually, probably need to wear it when you're out and about in the winter as well, especially when it's cold, because you can get like the windburn effects. We might also, on top of this redness, have something that we possibly haven't had since we were teens, more spots, more acne. And this is because of the change in your estrogen levels. Because it's changing, your skin isn't quite sure what it's doing, and the estrogen isn't there as in the same levels as it was previously. So when you had the change in hormones when you were a teenager, we're sort of like having the same sort of things going on now as we go through menopause. So again, you want to make sure that your skin is clean. You want to make sure that you are protecting your skin. Moisturizers, sun protection, maybe get moisturizers that have got SPF in them so that you're doing a double. Or maybe you can get the coloured foundations, moisturising foundations that have also got SPF in them so that you can still protect your skin. Something that can be quite embarrassing. Sorry, I put my hand in front of my mouth at this stage. Facial hair growth. It's something that we're all going to contend with at some point to a more or a lesser degree. The common areas are in the chin area, the upper lip, down below the jowl. Now, there are a number of ways that you can treat this. So you can just pluck. You can have it waxed. You can have threading. You can shave. You can use the creams. Or you can go for the laser treatment to totally remove the hair follicle. Choices are yours. Budget is your choice as well. So that you can decrease the amount of hair that you've got there. And you might find that they are more whiskery type of hairs at this stage. Now, not just little fine, when you get the peach fluff by the side of your cheeks, I get quite a lot of peach fluff, but this area here, they can be quite whiskery. So we need to remember that as we are heading into menopause, some of us of certain ages, when we were younger, we didn't slap on so much sun cream. So we need to be more aware of the sun as we age. So we should always choose products that have got some sort of SPF protection within them when we are going outside. And we need to keep an eye on changes in our skin surface. So if we are getting spots that are coming up that aren't going away, if we are getting brown areas that are becoming itchy, certain things like that we need to keep an eye on, and we may need to seek medical assistance to just check them out and make sure that they aren't anything too sinister. Because highly likely, if you're anything like me, when we were back in the youth back in Spain, we used to, rather than putting on proper SPF protection, we used to be in something that was called citron oil, and basically it was olive oil that smelt of lemons. Didn't do our skin much good, really, on a SPF protection. However, made us look and smell quite nice. So sunspots are things that we need to keep an eye on as we age, making sure that we are protecting our skin as much as we can when we go outside. We may also, because of the estrogen changes and the loss of our collagen, we may be more prone to things like bruising, weaker skin. I know that when we often have to nowadays have more blood taken than we used to, and sometimes you get more bruising. I know the bore on the needles is a lot better, but we can get bruising from that. So we have to be aware of bruises. We have to be aware of any cuts. And because of the reduced collagen, they may take a little bit longer for them to heal. So if we are thinking HRT, that can assist with maintaining the skin integrity. Also, because the collagen is becoming less, we may become jowly round here. This is due to our estrogen. So we can do a little bit about it if we can do facial yogas, make sure that we are staying as fit and healthy as we can, then that can help with the structure underneath to make sure that our skin is staying on our faces. I know, can be a little bit annoying, can be a little bit demoralizing as well. So, what do we need to do in summary? We need to keep an eye on our skin changes because some of them may need a little bit more intervention. They are inevitable. There are things we can do about it. HRT can help if we're going to take, if we're going to have the patches, estrogen gels, they can help. SPF, always wear SPF. Every product that you have should be an SPF product so that it's giving your skin protection. So I hope some of those tips have helped you as you are going through this phase. And if I can help you further, drop me a note below and I will get back to you. My name is Tracy Montgomery. I talk about all things menopause, midlife, and all that goes with it. Talk to you soon. Bye for now.